people know that their biometrics and personal details are used for analysis, but they are very uncomfortable when it comes to health surveillance.
What Gen X and, all those generations, what they will actually put out online, there is a different generation now. More than 60% of all funds that are flowing to the usual suspects for women, right? Whether that's breast cancer or whether that's all of our fertility.
Given that you founded your response on the basis of your conversation with the Harvard team, they came out with a study which says that as there is an expanse of digital opportunities, especially in the healthcare segment, people realize that there's also democratization of surveillance. Given that many analytical tools look at how some pharmacological interventions respond vis-a-vis gender.
Yes.
What was fascinating is that they reached the conclusion that people know that their biometrics and personal details are used for analysis, but they are very uncomfortable when it comes to health surveillance. Your thoughts on that from the gender perspective?
Yeah, I mean, it's interesting. It's interesting if you look at the generations of what Gen X and, all those generations, what they will actually put out online, there is a different generation now. I mean, not all of us grew up that way. None of us are comfortable, with what we see online. But I think that is changing, particularly in situations where the data, and I think, I was with the Mayo Clinic, they have now the records, birth to death, of 100 million people, all de-identified. And, enormous data sets. So I think where the data sets are de-identified, it's incredibly powerful. And if it's all part of your health record, then I think it actually can create enormous opportunity.
Within Femtech, those who can afford, all the money goes there. Those who do not have enough access or perhaps are dependent on government medical services, which are obviously low cost and affordable, the investment may not flow there. Is there a way to prevent that from happening?
Yeah, so maybe I'll take it from a couple of angles and maybe just building. So firstly, I think just where is the money going? So more than 60% of all money that all funds that are flowing to the usual suspects for women, right? Whether that's breast cancer or whether that's all of our fertility, So we know that that's where the money is. What do we expect next? We expect that we will continue in topics that are specific to women. So menopause in particular, I think we expect to see endometriosis as well. But really where it will really start to have the impact in a even a more significant way, and where we expect to see the funds start to flow next, will be in topics around cardiovascular, some of the neurological diseases, whether that's MS, Alzheimer's. And so, when we see about, kind of talking about what conditions, maybe just starting there, I think that's how we see sort of the flow of funds. Now, then the question is, how do those funds proportionally or disproportionately flow to, particularly for digital health, flow to more, kind of the global north or the global south? And I think, clearly there's, more funds that are flowing to the global north. The key is with, what UNFPA is doing, I think is very, very inspiring. Many of you may know, but they've now set up a fund that is really about how do we scale but tailor technology that is developed in the global north, but tailored for the global south.